The author has no financial interests. Nature is beautiful, but has lots of allergens. Ocular allergy is a worldwide disease. In the United States alone, many millions of people suffer to its consequences. Billions of dollars are spent by pharmaceutical industry in research of anti-allergic drugs as much as seen for dry eyes. Allergies can happen in different levels. On its lightest forms, it shows only an homogeneous hyperemia and a diffuse edema. On the severe forms, especially in the vernal keratoconjunctivitis, besides the immunologic signs, also an inflammatory aspect can be seen. To both, minor or major forms, itching is the main symptom. On intensest allergies, many signs may be found, like tearing, strong hyperemia, mucus discharge, neovascularization, white infiltrates, tendrous nodules, signs of keratocombs, shield ulcers, giant papillae, and symptoms like photophobia, itching and decrease of visual acuity. After starting treatment, it became better looking. But what else can we see? Pigments. Many pigments. Indeed, we have seen it happening often, especially in teenager patients. In those Brazilian patients, pigments have been seen associated to allergic signs. Higher levels of cutaneous pigmentation are known to be a major cause of ocular pigmentation, including conjunctiva and also reported in caruncle. That study concluded that caruncular pigmentation, like other pigmentations, is racially influenced. Nevas are the most frequent reported caruncular lesion in the majority of studies. Classically, neva appear near puberty and may show slight change in size or color with time. The primary acquired melanotic lesions are another possibility. They are rare in Caucasians, but not in Chinese. They concluded that conjunctival hyperpigmentation is associated with ethnicity. Staining caused by a long-term use of cosmetics and topical drugs, like epinephrine and silver. None of those studies mentioned any relationship with allergies. Could allergies be an extra cause of ocular pigmentation? A slight difference can be seen between racial and allergic pigmentation. These are examples of common racial pigmentation. This is allergic pigmentation. Even after many years, they still can be found there. This particular patient was submitted to a biopsy. As expected, we found intense eosinophilia from secondary inflammation and presence of melanin. Some inflammatory diseases, more commonly dermatological pathologies, may also attract melanin. This is called post-inflammatory hypercromia. Pigments are attracted initially to inflammatory sites and vanish in a late stage. Prostaglandins also can move pigments due to its pro-inflammatory properties. Brazil is a country with huge racial diversity. There, the primary acquired melanosis is common. Due to the presence of gross pigmentation in so many cases of allergy, we also started to suspect of tiny pigmentations at the caruncle or the plica, even in white clear eyes. Would it be reasonable to diagnose allergies by this sign alone, even in quiet, clear eyes? To demonstrate this possible relationship, 94 patients showing no signs of allergies were submitted to immunologic tests. Those patients didn't have any sign of ocular allergies and did not complain about itching. Around 90% had allergies immunologically confirmed. 65% had an allergic rhinitis diagnosticated. 22.6% cases at further investigation had a diagnostic of form first of keratoconus. Our theory is pigments are more stimulated by inflammation in some selected ethnic population. It's important to better advise these patients about salutary habits, and further studies are necessary to gather scientific knowledge to test and explore the real nature and behavior of this possible new sign. Thank you.